Hi, Dr. Rowe here, and today we're going to talk about the signs and symptoms of depression in children and teens. I am an integrative and pediatric mental health expert who's on a mission to change the way we view and treat children's mental health. If you're new to my channel, hit subscribe and turn on your notifications so you get my videos every week. Let's dive in. So most parents are often surprised when their child or teenager turns up with depression, but the signs and symptoms are often there long before the diagnosis. On average, it takes a person 11 years to get clinical help from the first onset of a sign or symptom of a mental health issue. And depression is one of those mental health issues that often takes years to really fully see that your child has been struggling with mental health, because those signs and symptoms start out small and build over time. Often, depression starts with anxiety. What are those signs and symptoms of anxiety? They are things like irritability, a need for frequent reassurance by asking questions like, are we going to be there on time? Are you going to wait in the room until I fall asleep? And it's not just a one-off. These are things that happen all the time, this need for reassurance. It's one of the biggest signs that your kid is sort of bubbling in the inside. What do we do as parents? We reassure, we comfort, and sometimes we don't see how much our child really needs us to regulate. And sometimes we do, and we don't know what to do about it. What are other signs and symptoms of depression? So certainly we talked about irritability, can be withdrawn behaviors. Anger is a very common misunderstood symptom of depression. Really, I call it the viper response, right? So kids that are like quick to fly off the handle, high emotionality, reactivity. Sometimes we know our trigger. Sometimes we know it's an annoying sibling or the bus ride. But sometimes kids with mood regulation issues sort of fly off the handle without much of a trigger. But sometimes there are things that happened before, the day before, earlier in the day, and they build. And holding it together all day at school can be a sign and a symptom that your child is struggling with a mental health issue when they come home and there's just a constant explosion. Another sign of depression is difficulty regulating your energy and being tired, which then causes sleep issues or difficulty waking up on time. Now, okay, you've got a teenager and they can't get up in the morning. It doesn't mean they're depressed. It probably means they're tired. But if it's really an issue all the time and they're fatigued and, sleeping day and night, certainly whenever somebody has chronic fatigue, you want to get a thorough medical exam, have some lab work done, check their thyroid, make sure there's not nutrient deficiencies like vitamin D, the B vitamins. Really important to make sure there's not an underlying health issue, because there often is. Another sign of depression is verbal impulsivity. Again, that sort of viper response, but instead it can be sort of these flashes of anger that come through and maybe some verbally inappropriate responses to you or to other kids, including, teenagers. These are signs that your child is having a difficult time regulating. And that's what depression really often is about for kids, is a dysregulated response. The response doesn't seem appropriate for the situation, right? So there's some normalcy in that as kids are becoming more independent, as we talked about in our last video. Is my child's behavior normal? When should I be worried? And also, people with depression often have peer issues, difficulties maintaining friendships. You might see difficulties not only maintaining friendships, but their friendship group may be kids with similar issues. And that's certainly not a horrible thing if the kids are all working on their issues together. If they're, a ship going down and they want to drag your kid with you, that's not a good match, right? So we always want to have peers that help each other regardless of their circumstance. But if we have a positive outlook and they're with kids that maybe do share the same kind of issues, but they're working on them together, it can be pretty amazing for kids. If you think your child is struggling, what should you do? Obviously, you should always go to a licensed mental health professional and seek help, as well as I'm a big fan of getting a really deep medical exam is incredibly helpful with lab work that again looks at your thyroid, nutrient levels. I pretty much never see somebody with depression that doesn't have low levels of some of the B vitamins and vitamin D. Vitamin D is the hormone regulator of the body and is really important in mood. And I always like to know what your levels are before you supplement. So what's my big Dr. Rowe? No, it's that thinking your kid isn't depressed because they're functional. Kids and adults with mental health issues mostly are functional. You can have a child who's depressed, but a straight A student. It happens, and it happens more often than not. It's only when their depression is really serious and significant that sometimes they can't fully hold it together. But with such emphasis on grades today, kids are much better able to hold it together, produce high-level work, and then be a mess in another area of their life, right? Like maybe home life. Maybe they're a nightmare at home, but they're a straight A student. If you're seeing a weakness, a difficulty in any of those life areas, not just academics, relationships, home life, work, then there is a problem. So what's my Dr. Rowe go? Supporting your child's mental health with natural treatments. My top natural treatments are things like breathwork, which I have a great YouTube video, so make sure you watch that, meditation, yoga, and of course, neurofeedback. What's another Dr. Rowe go? Encourage movement. Get moving. When you or your child is struggling with mood or anxiety or any mental health issue, we want physical movement. Feel good endorphins come out when we move. When you're depressed, you want to isolate, you want to not really join the world. And so by creating movement, it helps to bring energy up. You're getting blood flow and oxygen to your brain. It's a healthy thing. And then, as I like to say, if you're moving with your kids, you're able to connect and communicate. And when the body's moving, the lips are more likely to move. And so communication can happen, and you can help support your child's mental health by helping them address issues. But more importantly, you're just creating a great space and a connection. And my last Dr. Rowe, go celebrate small steps. I think one of the biggest things I've seen in 30 years in working with parents is unrealistic expectations for their own mental health, but especially for their children. Healing and working with a mental health provider, whether you're doing, cognitive behavioral therapy or exposure and response or neurofeedback, it doesn't matter. It doesn't look like this healing. It looks like this. So when we celebrate those small steps, a lot of good things happen. One, you're teaching your child to be present and connected and mindful in the moment. That is so important in the world of very hurried world, very stressed out world we live in. And so those little moments help us to build that resiliency mindset that I love to talk about and have a great YouTube video on. How we view stress is everything. If two people see the same situation and one doesn't see it as stressful and another one does, the person who doesn't see it is just not going to react. Their body isn't going to react. And so they're much more, as I like to call it, and there's a great theory, they're stress inoculated. They're not going to have that same kind of negative emotion, body sensations in the same way that this person does who sees it as a stressor. When we celebrate those small steps, we're present, we're connected, we don't view stressors in the same way. But also, when you are depressed, everything feels like a mountain. And so when we celebrate those little steps, we take the gains towards that, a lot of beautiful things can happen. People can see themselves as getting better. They can be much more hopeful, because if we only think this is success, right, the biggest things in life, we will be miserable. For somebody who's struggling with mood, they already find it hard to build momentum and motivation, and that's why celebrating the little things are huge. So remember, if you or a child you care about is struggling, it's gonna be okay. I am here to show you how to help children and teens feel calm, alert, and good about themselves. I want to hear how you're helping a child with depression or mood issues, so drop the comment below. Catch you on the next episode, and remember to subscribe to the Dr. Roseann channel, where we talk about natural and effective ways to reduce and reverse mental health.